This video will review the latest clinical research in the treatment of shoulder impingement. And the biggest reason why you want to treat shoulder impingement without surgery is because arthroscopic subacromial decompressions have no difference in outcomes when compared to exercise therapy. Let's try to understand why. Hey everyone, Dr. Jeff Peng here. Now, if this is the first time you're watching one of my videos, my goal is to help each and every one of you live an active and healthy lifestyle. So if that's something you're interested in, please consider subscribing to my channel. Now, I often give lectures to family medicine doctors in training, sports medicine specialists in training, and other practicing physicians. The following is a clip from a recent lecture that I gave examining why you want to treat shoulder impingement without surgery. Okay, so the next thing that we're going to talk about is shoulder impingement. Now, subacromial impingement syndrome is actually the first stage of a bigger spectrum of problems called rotator cuff disorders. It first starts as subacromial impingement syndrome, which then can progress into partial tears of the rotator cuff tendons, which can progress into full thickness tears, which can progress into massive tears and rotator cuff arthropathy. And I found that most people don't actually have a good understanding of what subacromial impingement syndrome is. So I do want to spend some time talking about this because that'll help you understand why surgeons decide to operate and what treatments ultimately end up working or not. So to first understand subacromial impingement syndrome, you got to first understand the shoulder is an incredibly complicated joint, right? You have a ball that sits on a tee, so a golf ball that sits on the tee here. Your humeral head sits on the glenoid. And as you lift your shoulder up, you have a complex set of muscles, all your rotator cuff muscles, all your scapular stabilizer muscles. They're helping control the movement of the ball to make sure it doesn't move around as you lift your shoulder up. So when you look laterally, right, as you lift your shoulder up, there's a small space called the subacromial space between the humeral head as well as the edge of the acromion. And so in subacromial impingement syndrome, as you lift your shoulder up, there is some type of biomechanical problem, whether your rotator cuff is weak, whether your scapular stabilizer muscles are weak, there's some type of biomechanical problem that prevents your humeral head from being stabilized in the socket. So what ends up happening is that humeral head starts to move around and it can ride up high. When it rides up high, it's going to start impinging against the acromion, and specifically it's going to irritate or damage whatever structure is caught between. And the structures caught between is the subacromial subdeltoid bursa. And so when you impinge the bursa, that's what results in a bursitis. That's what's directly responsible for the pain. But it can also cause damage to the rotator cuff tendons. And that's why impingement syndrome is literally you're getting a pinching sensation and you're damaging whatever the structures are in between the humeral head as well as the edge of the acromion. And that's why this is a progressive problem, right? You start with impingement syndrome, but repetitive trauma can lead to partial tears, it can lead to full thickness tears, and then it can lead to massive tears and rotator cuff arthropathy. And so that's why surgeons started asking the question, well, if this problem is an impingement syndrome, and impingement is because the space between the humeral head and the acromion is too tight, can we shave down part of the bone, specifically the acromion, to create more space? And if you create more space, well, then it's not going to impinge. If it doesn't impinge, then you don't get this progression in rotator cuff disorders, right? And so we started asking the question, well, does this surgery actually help? So this study, published in the British Medical Journal in 2018, subacromial decompression versus diagnostic arthroscopy for shoulder impingement, randomized placebo surgery-controlled clinical trial. And so in this study, they had patients brought to the operating room. They were divided into two groups. One group got a sham surgery, and the other group ended up getting a subacromial decompression where they shaved down part of the bone to create more space in that subacromial space. And what they found in this controlled trial involving patients with a shoulder impingement syndrome, arthroscopic subacromial decompression provided no benefit over diagnostic arthroscopy or the sham surgery at 24 months. They go on to publish 5-year outcome data, and they find arthroscopic subacromial decompression provided no benefit over diagnostic arthroscopy or exercise therapy at 5 years for patients with shoulder impingement syndrome. And so what are we supposed to do with these patients then? Well, it's important to understand that all of this is a problem with mechanics. Remember, your rotator cuff, your scapular stabilizer muscles, there's some type of biomechanical problem that's causing abnormal motion of the shoulder. And as long as that biomechanical problem is still there, you're going to get impingement. And so that's why a home exercise program works. That's why physical therapy works. That's why really focusing down on activity and load management works. Ultrasound-guided injections have also been shown to be beneficial. We'll talk about that in a little bit. And also evaluating for myofascial trigger points, which we'll go over in a future talk as well, can also be extremely beneficial in terms of addressing biomechanics. And so since all of these studies come out, so we talked about arthroscopic partial meniscectomies potentially having no benefit, subacromial decompressions potentially having no benefit. This was actually the cover of the British Journal of Sports Medicine back in November 2020, where you have, a lot of more seasoned orthopedic surgeons bowing down to the legend of arthroscopy, and you have a younger generation of physicians walking towards the light, which is evidence-based medicine. This study was published in the British Medical Journal in 2021, Common Elective Orthopedic Procedures and Their Clinical Effectiveness. This is an umbrella review of level 1 evidence. And they go on to say that there's no strong high-quality evidence, shows that many commonly performed elective orthopedic procedures are more effective than non-operative alternatives. Despite the lack of strong evidence, some of these procedures are still recommended by national guidelines in certain situations. The mainstream media has also picked this up. This was earlier this year, January 4th, 2022. Concerning bone or joint surgery, you may not need it. For many common problems of the knee, hip, shoulder, spine, and wrist, non-surgical options may be just as good. And if you're interested in learning what exercise that I recommend to treat shoulder impingement, check out this video next. Thanks for watching.